So question here, a 25 years old male brought to the emergency room, right, with a piece of metal in his eye. The first action the nurse should take. So emergency department, a patient came, something or metal get inside the eye. So what are the first action? Number A, use a magnet to remove the object. It is metal, use the magnet, but it does not make sense. It is medical science. Number B, raise the eye thoroughly with a saline. Number C, cover both eye with a paper cup. And number D, patch the affected eye. So the correct answer is number C, means you have to cover both eye with the paper cups. Why number D is not an answer, right? So covering both eye prevent the consensual movement of the affected eye. So if you patch one eye, another eye movement, then times other eye also movement. So answer A is incorrect because the nurse should not attempt to remove the object from eye because this might cause the trauma. And raising the eye is started with saline, means answer B might be ordered by the doctor, not by us. But this is not the first steps for the nursing action, right? And number D is not an answer or is not correct because often when one eye moves, the other eye also moves. This is the reason cover both eye with a paper cups. Next here, to ensure safety while administering a nitroglycerin patch, the nurse should do what? Wear the gloves while applying the patch. Number B, shave the area while patch will be applied. And number C, wash the area thoroughly with the soap and rinse with a hot water. And number D, apply the patch to the buttock. In this question, the key word is nitroglycerin patch. We use the nitroglycerin because of the angina or chest pain. Nitroglycerin is a vasodilator. But the nurse should do how put it, right? Out of 4, which one is ideally should do? The correct answer is number A, means wear the gloves while applying the patch. Why? To protect herself, right? This is the one option. The nurse should wear the gloves while or when applying a nitroglycerin patch or cream. Answer B is incorrect because shaving the area or skin might be caused the burning sensation or abrade the area. Answer C is incorrect because washing with a hot water will vasodilate and increase the absorption, right? Hot water, not an answer. And number D means the patch should be applied to the area above the wrist, not a buttock. Wonderful. What next? Next question here we say, the client with a cirrhosis. Cirrhosis is the chronic liver disease. non-functioning liver is causal for paracentesis. When my liver does not work, fluid is accumulated in the abdomen and it is called ascites. So doctor need to remove the water from abdomen. It is called paracentesis. Which instruction should be given to the client before the exam, right? A, you will need to lay down flat during the exam. B, you need to empty your bladder before the procedure. Number C, you will be asleep during the procedure. Number D, the doctor will inject a medication to treat your illness during the procedure. So what is your answer? Your answer is you need to empty the bladder before the procedure. Very important. Why number B is answer? The client should schedule, right? The client scheduled for a paracentesis should be told to empty the bladder. Why? To prevent the risk of puncture the bladder when needle is inserted through the abdomen, right? Because we use a needle in the abdomen to collect the fluid. Behind the organ or viscera, we get the urinary bladder. If urinary bladder is distended, chance to puncture, inserted. So a paracentesis is done to remove the fluid from peritoneal cavity. The client will be positioned sitting up or leaning over bed table. Or so answer A is not a correct answer. So the client is usually awake during the procedure, so do not need a sleep. Also, medication are not commonly instilled during the procedure. So answer C and D is not correct. What else? So next question here. The client is scheduled for Tensilon test to check the myasthenia gravis. Which medication should be kept available during the test? Number A, atropine sulfate, furosemide, or prostaglandin or promethazine. So before to answer this question, I want to share with you about something myasthenia gravis and Tensilon test. Myasthenia gravis, it is a neuromuscular disorder that leads to the weakness of skeletal muscle, right? So the patient who have myasthenia gravis, so if you or someone you know is exhibiting the symptom of myasthenia gravis or who looking for the medical attention immediately, so the initial symptom is usually specific muscle weakness and fatigabilities. Also, weakness and fatigability rather than the generalized weakness. And weakness odds with the exercise and as the day progression or progress. Generally, the weakness often affected the eye muscle to facial muscle and then limb muscle. The eye problems such as the dropping or double vision is common, problem with the speaking, problem with the swallowing, or problem with the chewing. So whatever it is, what are the tests we do for the patient? And this is called Tensilon test. Tensilon test, also known as endophonium test. So Tensilon or endophonium test, a test to diagnose neuromuscular disorder, so-called myasthenia gravis. So out of 4, the correct answer is atropine sulfate. Atropine sulfate is the antidote for Tensilon and is given to treat the cholinergic crisis. The answer B, furosemide, is a diuretics. Answer C, like prostigmine, is the treatment for myasthenia gravis. And promethazine is a anti-emetics, also anti-anxiety medication. So answer B, answer C, and answer D are not correct, are incorrect. What else? The first exercise that should be performed by the client who had a mastectomy 1 day early is. So your patient has a history of mastectomy, right? So now say who had a mastectomy, the 1 day early is walking the hand up the wall, sweeping the floor, combing the hair, and squeezing a ball. The correct answer is a squeezing the ball. The first exercise that should be done by the client with a mastectomy is squeezing the ball, right? So I said the first exercise is squeezing the ball, right? So mastectomy or mastectomy means removal of the breast because of any kind of tumor, right? Surgical removal, right? So it is important after there's some complication of mastectomy, like problem with anesthesia, injury to the sounding nerve, bleeding, infection, or build up the blood or fluid in surgical site. But we are not talking about the complication. So we are just giving an overview about the procedure. So we usually what to expect before the procedure or after the procedure. We provide the doctor with a list of all current medication and continue or discontinue them as instructed. Or do not eat or have any food at least 8 hours before the procedure. And also bring your personal belongings and prepare your patient at the operation day. Whatever after the operation in post-recovery period or when patients are going to be stable, the first things we can tell them, squeezing the ball, right? So after the procedure, let me tell something more. Always with dressing and bandage is placed at the surgical site. Sometimes patients complain of pain or numbness. Pain or numbness may be felt at the site of surgical operation. Instructions are provided on how to care for the incision and on how to identify the sign of infection. After the surgery, if patient come to you with a high-grade fever, it indicates has an infection, right? Also, with prescription medications such as the pain reliever or antibiotics may be given. What else? Next question, which woman is not a candidate for rhogram? So, which candidate? A gravida 4 para, a gravida 4 para, sorry, a gravida 4 para 3 that is Rh negative with Rh positive baby. Number B, gravida 1 para 1 that is Rh negative with an Rh positive baby. Number C, gravida 2 para 0 that is Rh negative admitted after the stillbirth delivery. Number D, a gravida 4 para 2 that is Rh negative with Rh negative baby, right? And I'm over sure you already know the answer. The correct answer is number D, a gravida 4 para 2 that is Rh negative with Rh negative baby. Sorry, I did something wrong. In this question, say which woman is not a candidate, right? Not. So gravida 4 para 2 Rh negative, baby also negative. They are okay. I do not need to give them rhogram. Is not a problem. But number C, Rh negative and stillbirth. Number B, Rh negative, but baby is a positive. Number A, Rh negative, baby is positive. Then must need to admit rhogram. So the mother answer A, B, and C all require rhogram and thus are incorrect. Answer D is the only mother who does not require rhogram injection, because there are no way to develop antigen antibody reaction. What else? Which laboratory test would be least effective in making the diagnosis of myocardial infarction? A, AST, B, troponin, CKMB, and D, myoglobin. In this question, the keyword is a least effective, making the diagnosis of myocardial infarction. Because of least and myocardial infarction, the correct answer is AST, right? Answer A or AST is not specific for myocardial infarction, but troponin, CKMB, and myoglobin, or answer B, C, and D are more specific, although myoglobin is also elevated in burn patient or trauma to muscle patient. Whatever it is, It is also the biomarker of heart patient. AST means aspartate aminotransferase, shortly called AST. AST test is a blood test that is checked for liver damage, not a heart. So usually your doctor might order this test to find out if you have liver disease, right? Or to monitor your liver disease treatment. So if your liver is an organ that has many important roles usually do. If any liver problem, cirrhosis, or any other chronic liver disease, AST will be altered. And troponin test is a blood test that can help to assess the heart damage. And it is used along with the other diagnostic tests to help to evaluate the likelihood of the heart attack. And CKMB, this test to distinguish between skeletal muscle and heart muscle damage. Sometimes to determine if you have had a heart attack, if the troponin test is not available, and sometimes to detect a second or subsequent heart attack, or to monitor for an additional heart damage. And myoglobin is an early biomarker to aid the diagnosis of myocardial infarction. It is a one sample or one run or instrument increase the effectiveness in triaging the chest pain patient, right? Myoglobin test can be used as an aid in the diagnosis of myocardial infarction. What next? Next, the client with a myocardial infarction comes to the nurse station, and starting that, he is ready to go home because there is nothing wrong with him. Which defense mechanism the client is using? So client with a myocardial infarction come to the station, and starting that he's ready to go because he said nothing wrong with him. So he want to go, right? Number A, it is called rationalizations defense the client using. It is deny, projection, number D, conversion reaction. So the correct answer patient is deny. The client who say he has nothing wrong is in deny about his myocardial infarction. Why not rationalizations? Rationalizations is making excuse for what happening, or projection is projecting feelings or thought onto others, and conversion reaction is converting a psychological trauma into the physical illness. So rationalizations, projections, and conversion are incorrect. A client is receiving total parental nutrition, shortly called TPN. Which lab test should be evaluated while the client is receiving TPN. Hemoglobin, creatinine, blood glucose, and white blood cell count. Definitely answer is number C, right? You might be asking why. So when a patient take the TPN, means total parental nutrition, means patient have some pathology in the GIT, gastrointestinal tract, they are not taking to able the food through the mouth. Usually TPN or total parental nutrition, we use the dextrosaline solution, and dextrose contain the glucose, and bacteria love eat glucose, right? So when we use the TPN dextrose solution, it is because of the glucose easy to develop the bacteria, and bacteria can cause infection. So when the client is receiving TPN, the blood glucose level should be drawn to check the blood glucose. TPN is a solution that contains the large amount of glucose and causes to develop bacteria, and bacteria cause infection. So answer a hemoglobin, we check to see anemic or not. Creatinine is a marker for kidney function, nothing related to TPN. And white blood cell, it is called, shortly called, it is the important WBC. We check during the CBC, complete blood count. When it is increased, it indicates infection. So answer A, answer B, answer D are incorrect because directly not related to the question. So a client with the diabetes is preparing for discharge. During the discharge stitching, the nurse assessment the client's ability to care for himself. Which statement made by the client would indicate a need for follow-up after discharge? A, I lie by myself. B, I have trouble sleeping, seeing. I have cat in my house with me. And D, I usually drive myself to the doctor, right? So during the discharge stitching, the nurse assessment the client's ability to care for himself. But which statement made the client would indicate need follow-up after discharge? So if patient said, I have traveling to seeing, means vision problem. I lie myself, nothing related to my disease. I have cat at my home with me, nothing wrong. I usually drive myself to the doctor, nothing wrong. But if they said I have a difficulty of seeing, means blood sugar is not controlled. It affected your eye vision. So answer B is correct. So a client with a diabetes who has troubling to seeing would require follow-up after discharge. The lack of visual acuity for the client preparing or injecting insulin might require help. Another cause. Answer A, answer C, answer D will not prevent the client from being able to care for himself and thus are incorrect. What else? The client with cirrhosis of the liver is receiving lactulose. Cirrhosis of the liver receive lactulose. Cirrhosis of the liver means non-functioning liver, nodule pain. The nurse is aware that the rationale for the order for lactulose, number A, lower the blood glucose level, B, lower the uric acid level, number C, lower the ammonia level, and number D, lower creatinine level. So the correct answer to lower the ammonia level. When my liver does not work because of cirrhosis, the waste product difficult to eliminate from the blood. Waste product is accumulating in the body, and this waste product is nitrogen containing substance, and this is ammonia, shortly called NH4, nitrogen containing substance, right? When ammonia level go up, they get inside my brain and patient feel confusion. So doctor prescribed lactulose, and lactulose absorb bad ammonia from the blood. So the correct answer is C. Lactulose is administered to the client who have cirrhosis. Why? Because lactulose lower ammonia level. And answer A, lower the blood glucose. Answer B, lower the uric acid level. Answer D, lower the creatinine level. Is incorrect because they do not have an effect on the other lab values. What else? The next question. The client is receiving peritoneal dialysis, means patient kidney does not work. If the dialysis returns cloudy, nurse should do what? When patient has a chronic kidney disease, shortly called CKD, or if patient has an anal stage renal disease, right? Patient need the peritoneal dialysis. Or if the GFR, glomerular filtration rate, is too slow, kidney non-functioning, we need to eliminate, expel out the waste product, but my kidney does not work, I need dialysis. Dialysis is two types. One is peritoneal dialysis, right? It is temporary. But when patients go for the fistula, we can do the permanent dialysis procedure. Whatever it is, when we give the fluid to dialyze it, and the fluid came out in this cloudy, means infection is there, right? So number A, document the findings. Number B, send a specimen to the lab. And number C, strain the urine. And number D, obtain the complete blood count, right? So cloudy means infection. So I need to send the specimen to the lab. This is the answer, right? This is the answer. B is correct answer. So if the dialysis returns cloudy, infection might be present and must be evaluated. So send the specimen to the lab. Documentation of the findings is important, but I have to do what is the first priorities. So a started answer A are not enough. Starting, urine, staining the urine is important, but it is not the priority. It's incorrect answer. Answer D is not the urine at all. Another thing is complete blood count is important, but I have to send it to the urine specimen to culture, right? Or specimen for the lab test.